One bill sent to the governor's desk this special session outlines how Texas will spend $16 billion in federal COVID relief. More than $7 billion will go to the state's unemployment insurance fund. In 2020, the Texas Workforce Commission faced a 948% increase in unemployment claims. The agency paid to add contract call centers and revamp its website. Some Texans are still having a hard time connecting, though, but the federal relief won't help with staffing at TWC.
It, first of all, replenishes that money that we borrowed from the federal government, pays that loan back, and it also gets us back to the stable level, the floor of money that we're required by the law to have.
If lawmakers didn't allocate this money, the state would have to tax businesses more to replenish the fund. Texas lawmakers also set aside hundreds of millions of dollars to tackle the staffing crisis at nursing homes. Avery Travis looks closer at why the money is more important now than ever.
Anything for mom or dad? No?
We would not be here today. I would not be sitting here today if we did not have a devoted staff.
But the executive director at Buckner Villas says they haven't been immune to the labor shortages facing other nursing homes and senior living communities. They particularly need staff caring directly for residents, such as certified nurse aides, or CNAs.
And that's where we're hurting the most.
A recent survey of more than 200 nursing homes in the state showed every one polled had vacant CNA positions. 70% said they couldn't compete with other employers. 63% had no applicants at all.
Because there's not enough of me to take care of all of you, then I start feeling like a failure and I'm diminished.
Lori Porter is the head of the National Advocacy Group for CNAs. She applauded the Texas Legislature for thinking long-term about bolstering the long-term care profession. Lawmakers designated $2 billion for the state health department to provide surge staffing in these homes, along with hospitals and infusion centers. And in the funding bill, they earmarked another $200 million for nursing homes, too.
They're going to use these funds for things like recruitment bonuses and retention bonuses and to be able to pay for hero pay and incentives and all of those things necessary to compete in these hyper-competitive markets.
But Porter hopes the money can be used for the education and recruitment of new staff as well.
A whole new care force throughout Texas.
Avery Travis for State of Texas.
The Department of State Health Services and Health and Human Services Commission will oversee the distribution of this money, likely in the form of a grant program. Texas adds rules to make power operators protect their plants against freezing weather, while it leaves out a crucial need to prevent blackouts. A former state guard member says she was forced out because she gained weight, the change in policy she's calling for now. New pressure over border policy, why the White House is now facing heat from both sides of the aisle to make changes.